Imagine this. You're 72. You feel healthy. You stay active, sleep well, and enjoy time with your family. At your yearly checkup, your doctor says, "Let's run a few extra tests, just to be safe." It sounds harmless. But weeks later, one unexpected result leads to another test, then a biopsy, then surgery, and suddenly you're recovering from a procedure you may never have needed. This happens more often than most people realize. I'm Dr. Nathan Ashford, and today I'll explain 5 medical checkups I personally think every adult over 65 should think twice about. Not because they're bad, but because the balance between benefits and risks changes as we age. Many screenings save lives in younger adults. But after 65 or 70, some can discover tiny abnormalities that would never have caused symptoms, while the follow-up procedures may carry real risks like bleeding, infection, complications, or loss of independence. The goal isn't to avoid medical care. The goal is to make smarter decisions based on your age, your health, and your personal risk, not fear. Stay with me until the end, because I'll also share 5 simple questions you should ask before agreeing to any screening test. Those questions could completely change your next doctor's appointment. Let's begin with the first medical checkup. Checkup #1. Routine colonoscopy. After 75. Let's start with one of the most common screening tests, a routine colonoscopy. Now, colonoscopies have saved countless lives by detecting colon cancer early. There's no question about that. But here's what many people don't realize. If you're over 75, have had normal colonoscopies in the past, have no symptoms, and are considered average risk, another routine colonoscopy may provide very little benefit while exposing you to greater risk. Why? Because colon cancer usually develops slowly. In many healthy older adults, a newly discovered small polyp may never become dangerous during their lifetime. However, the procedure itself still carries risks. The bowel preparation can lead to dehydration, especially in seniors. Sedation may increase the risk of confusion or falls, and although uncommon, complications such as bleeding or even a perforated colon become more likely with age. The question isn't, can a colonoscopy find something? Of course it can. The better question is, will finding it actually improve your health or extend your life? For many adults over 75 with no symptoms and previous normal results, the answer may be no. If you notice blood in your stool, unexplained weight loss, persistent abdominal pain, or major changes in bowel habits, that's completely different. Those symptoms should always be evaluated promptly. But if you're simply repeating a screening because it's time again, it's worth asking your doctor whether a less invasive option, such as an annual stool-based test, might be more appropriate for your situation. Remember, the goal after 65 isn't to do more testing. It's to do the right testing. Checkup #2. PSA tests and mammograms. Not always better. The second checkup may surprise you. Many people believe that finding cancer as early as possible is always the best strategy. In reality, that's not always true after age 65 or 70. Modern imaging and blood tests are incredibly sensitive. They can detect tiny, slow-growing cancers that may never cause symptoms or shorten your life. This is called overdiagnosis. The problem isn't finding cancer. The problem is what often happens next. One abnormal result leads to more scans, then a biopsy, then surgery, radiation, or medication. For some older adults, those treatments can reduce quality of life far more than the cancer itself ever would. For example, many men develop very slow-growing prostate cancer as they age. In many cases, It grows so slowly that it never becomes life-threatening. Yet once the word cancer appears on a report, it's natural to feel pressure to treat it immediately. The same can happen with certain breast cancers found during routine mammograms in older women. That doesn't mean you should stop screening altogether. If you have a strong family history, genetic risk, previous cancer, or new symptoms, screening remains extremely important. But if you're healthy, have no symptoms, and are considered low risk, it's worth asking one simple question before agreeing to another test. If this test finds something, will treating it actually help me live longer, or simply expose me to treatments I may never have needed? Sometimes, the best medical decision isn't doing more. It's choosing the care that truly improves your quality of life. In the next section, we'll discuss one heart test that many healthy seniors receive every year, even though it often leads to unnecessary procedures. Checkup #3. Routine cardiac stress tests without symptoms. Let's move to the heart. Many adults over 65 are offered a cardiac stress test during a routine checkup, even when they feel perfectly fine. At first, it sounds like a smart idea. After all, who wouldn't want to catch heart disease early? But here's the problem. If you have no chest pain, no shortness of breath during activity, no fainting, and no other warning signs, a routine stress test often provides very little benefit. Instead, it can create unnecessary anxiety. Stress tests are not perfect. Sometimes they suggest there's a blockage when there isn't. This is called a false positive. Once that happens, the next step is often more testing, such as a CT scan or cardiac catheterization. Those procedures carry real risks, including bleeding, allergic reactions, irregular heart rhythms, and, in rare cases, heart attack or stroke. Even when a blockage is found, it doesn't always mean a stent or surgery will help. Research has shown that many people with stable heart disease do just as well with medication, healthy eating, regular exercise, and controlling blood pressure and cholesterol. That's why doctors today focus less on finding every blockage and more on reducing overall cardiovascular risk. So instead of asking, "Should I have a stress test?" ask, "Will the results change my treatment?" If the answer is no, the test may not improve your health at all. Sometimes, the healthiest heart isn't protected by more procedures. It's protected by consistent daily habits. Next, let's look at a bone test that often leads to years of medication, but may not always be the best first step. Checkup #4. Bone density scans don't tell the whole story. Let's talk about your bones. As we age, bone loss becomes more common. That's why many adults over 65 are encouraged to have a bone density scan, also called a DEXA scan. The test itself is safe. The concern is what sometimes happens afterward. A scan may show mild bone loss, and before long, a prescription is written for long-term osteoporosis medication. For some people, that's absolutely the right choice, but not for everyone. If you've never had a fracture, you're physically active, and your overall fracture risk is low, medication may offer only a small benefit while introducing possible side effects. Some osteoporosis drugs have been linked to rare problems such as unusual thigh bone fractures or jaw complications after many years of use. That's why treatment should never be automatic. More importantly, a DEXA scan cannot tell you why someone falls. And in older adults, falls, not bone density alone, are often the biggest cause of broken bones. Improving balance, building muscle strength, getting enough protein and vitamin D, checking your vision, and making your home safer may reduce your fracture risk more than any pill alone. So, if your bone density is slightly low, don't panic. Instead, ask your doctor, based on my overall health, what is my actual risk of breaking a bone? That single question can lead to a much more personalized treatment plan. Next, we'll discuss one screening test that many people have never heard of, but it can sometimes lead to major surgery without improving long-term health. Checkup #5. Carotid artery ultrasound without symptoms. The fifth checkup is one that many people don't even know they're getting. It's called a carotid artery ultrasound. This test looks for narrowing in the arteries that supply blood to your brain. The idea is simple: find a blockage early and prevent a stroke. That sounds reasonable. But for healthy adults with no history of stroke, mini-stroke, TIA, or neurological symptoms, routine screening usually isn't recommended. Here's why. As we age, it's normal for some plaque to build up inside our arteries. Many people over 70 have mild narrowing that never causes a problem. The danger isn't always the blockage. Sometimes it's what happens after it's discovered. A scan finds narrowing. You're referred to a specialist. More imaging is ordered. Then surgery or a stent is recommended, even though the blockage may have remained harmless for years. Ironically, procedures on the carotid artery carry their own risk of stroke. So a test meant to prevent a stroke can occasionally trigger one. That's why the most effective way to lower stroke risk usually isn't another scan. It's controlling the things that matter most. Keep your blood pressure under control. Manage diabetes if you have it. Stop smoking. Stay physically active. Take medications exactly as prescribed. These simple habits reduce stroke risk far more than routine screening in someone who has no symptoms. Remember, the goal isn't to search for every possible abnormality. The goal is to stay healthy, independent, and enjoy life for as many years as possible. In the final section, I'll share 5 powerful questions every adult over 65 should ask before agreeing to any medical screening test. The 5 questions every adult over 65 should ask before any medical test. Before you agree to any screening test, I want you to remember these 5 questions. They may be the most valuable part of this entire video. Question #1. Why do I need this test? Is it because of my age? Or is it because I have symptoms or a higher than average risk? A good test should answer an important medical question, not simply be done out of habit. Question #2. What happens if the test finds something? This is a question many people never ask. Will the next step be another scan, a biopsy, surgery, or simply monitoring the condition? Knowing the possible path ahead helps you make a more informed decision today. Question #3. What are the risks of the follow-up treatment? Every medical procedure has potential benefits, but every procedure also carries risks. For older adults, recovery often takes longer, and complications can have a much bigger impact on daily life. Always ask whether the possible benefit is greater than the potential harm. Question #4. Is it safe to monitor this instead? Not every abnormal result needs immediate treatment. Many slow-growing conditions can be safely observed with regular follow-up. Sometimes, careful monitoring is the smartest medical decision. Question #5. What can I do naturally to lower my risk? This may be the most important question of all. In many cases, controlling blood pressure, staying physically active, eating a balanced diet, sleeping well, maintaining a healthy weight, and avoiding smoking provide far greater long-term benefits than another screening test. Remember, the purpose of healthcare isn't to collect as many test results as possible. It's to help you live a longer, healthier, and more independent life. In our final section, I'll leave you with one important message that every older adult and every family member should hear before their next doctor's appointment. Closing. The goal isn't more tests, it's better health. Before we finish, I want to leave you with one final thought. Modern medicine has given us incredible tools: blood tests, scans, screening exams, procedures that can detect disease earlier than ever before. But more testing doesn't automatically mean better health, especially after 65. The best healthcare isn't about finding every tiny abnormality. It's about asking one simple question: will this test help me live longer or live better? Sometimes the answer is yes, sometimes the answer is no, and sometimes the wisest decision is to watch carefully, stay healthy, and avoid treatments that may create more problems than they solve. That's why every medical decision should be based on your overall health, your personal risk factors, your life expectancy, and your goals, not simply your age. Never be afraid to ask questions. Never feel rushed into making a decision. A good doctor won't be offended. In fact, they'll appreciate that you're taking an active role in your healthcare. Remember, the healthiest people aren't always the ones who have the most tests. They're often the ones who stay active, eat well, sleep enough, manage chronic conditions, and work together with a trusted physician to make thoughtful decisions. If today's video helped you see medical screening in a new way, I'd really appreciate it if you subscribe to the channel. Every week, I share practical, evidence-based health advice designed specifically for adults over 60, so you can protect your health, maintain your independence, and enjoy the years ahead with confidence. And now I'd love to hear from you. Have you ever had a routine medical test that led to an unexpected diagnosis or treatment? Share your experience in the comments below. Your story may help someone else make a more informed decision before their next doctor's appointment. Thank you so much for watching. Take care of yourself, stay healthy, and I'll see you in the next video.